In this video, I will try to show what happens by time if we don't treat leukoplakia. In this video, I will show a bladder of an old lady who is in follow-up for long years by other doctors. She had plenty of infections and flares, infective attacks, but she is always treated with antibiotics and she didn't recover, she didn't completely treat it. So this is her bladder. When we look inside, this is a very thick membrane-like tissue, which is in the long run, leukoplakia becomes this way. It changes into a membrane-like tissue. And when we look into bladder wall, there are little granular tissues, little cysts in the bladder, which is formed after a long period of infection. Bladder mucosa becomes like this. It has changes, there are changes in the bladder mucosa, and these granular tissues here, little cystic tissues, infective cysts formed in the bladder. Yeah. We are marking the tissues. The fulguration site. In the trigon we can clearly see the abnormal change tissues which become cystic, little spheric appearances, spherical, round shaped tissue changes. Here we see abundant little cysts in the bladder, and here the leukoplakias. We begin fulguration. The membrane, leukoplakia membrane, is easily fulgurated, and these tissues are really a source, a bed for the infective tissues for bacteria, and they give too much pain because they are not impermeable to acid of urine, so they cause pain continuously. I try to scrape the tissue, but it's not possible, so we make fulguration. This tissue is very thick, so we continue like this to fulguration. Then we will fulgurate the little spherical formations here, these cysts. We will try to not to leave any diseased tissue behind. Throughout the fulguration, I noticed that it is not easy to superficially fulgurate these tissues. They don't go away. They just form little thick balls. Look at here, these tissues. When we fulgurate the superficial mucosa, underneath these ball-like structures, embedded tissue infections are left behind. So I try to fulgurate more and more, but most of them didn't disappear easily. So if we don't fulgurate the leukoplakias in time, I think they may have a change, and the tissues become thicker, and these cystic appearances, ball-like tissues, are formed. Histologically, when we send them to pathologic examination, they are called glandular cystitis or cystitis cystica, which is a further level of bladder infection. So when I understand that it's not easy to fulgurate them, we make a resection. This is a deeper. This is another feature of our device. So this device is used for bladder cancer operations and prostate operations. So it has the capacity to resect, to cut the tissue more deeply. So when we understand that it's not possible to fulgurate these tissues, we begin resection. Of course, we don't want to go too deep, so the resection must be superficial, because deeper resection will lengthen the healing process too much and may cause too much pain. We control the thickness of bladder mucosa here, and it is quite enough to make a resection. So these are the resected particles. We take them out by vacuum cleaning of the bladder with our instruments. Still there are some tissues, cystic tissues, but we don't want to make an extreme fulguration, extreme resection. So we clean the bladder. Here the resected parts healed very nicely, but the tissue damage is deeper. So we try to fulgurate other parts, but as you see, when we make a fulguration, the cystic infective tissues become prominent and they don't completely disappear. These are the previously marked borders. We don't want to leave any fresh tissue, old tissue, diseased tissue behind, so we fulgurate the superficial mucosa, but underneath you can see the coming out little balls of cystitis. These are really a source, a bed for infection, so we have to clean them out. So we continue the fulguration and, if necessary, resection, and we try to destroy all the diseased tissues. Here, this is a ball. We can, as you see, sometimes disappear them by fulguration, sometimes by resection. So in this video, I try to demonstrate what happens if fulguration is not done in a good age, in a certain age, what happens in the long run to leukoplakia tissues. So this is a 70-year-old lady, and she had no treatment for years, and her leukoplakia tissues, her infected bladder, become more and more infected, and these abnormal cystic little ball-like tissues has been formed in her bladder. Can we say it is true for all of the patients who didn't have fulguration? I can't say that. We don't have this much experience in long run, but it's very obvious that there are some ladies who will have these tissues if they are not properly treated.